Okay, good afternoon, everyone, and welcome to another social emotional workshop. Today we are with Lisa Kaplan from Henry Ford Health Systems, and we're going to be talking about the subject of marijuana. Lisa, welcome back. We're so glad to have you.
Okay, thank you. So marijuana is a big issue in our society. I know that you hear about it all the time. So we're going to just real quickly talk about what you need to know about marijuana. So the marijuana of today is not the same marijuana as when I was growing up. Back then, you could not become addicted to it because the THC, the active ingredient in marijuana, known as tetrahydrocannabinol, the THC was not nearly strong enough for people to get addicted. Well, nowadays, it's not the same marijuana. Today, it is intentionally grown to be stronger, and people do become addicted. Now, not everyone, just like some people become addicted to alcohol, but not everyone. Some people become addicted to marijuana, but not everyone will. So that's the major ingredient in marijuana. And if you live in Michigan, you know that it is legal both for medicinal and recreational purposes, but that does not mean that it's safe. And it's legal for people 21 and older, okay? And so as you may know, a person's brain is not fully developed until the age of 25. Teens and young adults who use marijuana before their brain is fully developed are actually priming their brain for addiction. So it's not a safe choice for them. Anybody who's in recovery from any type of substance use disorder should also not be using marijuana because all drugs lower inhibitions. Marijuana is a drug, it lowers inhibitions. And then of course, it makes someone think that their drug of choice is okay because their inhibitions are lowered. And of course, people can become cross-addicted, meaning they could be addicted to marijuana and another drug. So you may have heard the term gateway drug. Marijuana is considered, along with alcohol and tobacco, a gateway drug. So think of it as literally opening the gates toward harder drug use. People do not start with heroin. They start with tobacco, alcohol, and marijuana. So most insurance companies will not pay for a person to have inpatient treatment if they're addicted to marijuana because the withdrawal symptoms are not severe enough and it's not medically dangerous, but certainly people can get help in an outpatient setting. So what is marijuana? It's a plant. It's the dried leaves, flowers, stems, and seeds from the plant. And the plant contains the chemical THC. And we're going to talk about extracts in a minute. So people can smoke marijuana either in a joint, which looks like a little hand-rolled cigarette. It could be a blunt where they take like a cigar and empty out the tobacco and fill it with marijuana. In pipes, in water pipes or bongs, and of course, electronic cigarettes like vapes can also be used to use marijuana. The other way to use it is in what we call edibles, so food and drinks. So brownies, cookies, candy, or it can be brewed as a tea. So it's not really very safe. What happens with edibles is it takes a longer time to make a person high. So for example, if I ate a marijuana brownie, nothing happens. So I eat another one and nothing happens. And then I eat a third one and number one kicks in and number two kicks in and number three kicks in. So it could be pretty dangerous. Some of you may remember hearing on the news that a middle school had a bunch of kids who got sick in school because of marijuana. What happened was somebody soaked gummy bears in marijuana oil and then gave them out to friends. And what happened is the gummies, which the kids thought was candy, absorbed the marijuana and made them very high and many of them very sick in school. So it's not a safe thing to do for sure. Parents who use marijuana might have a plate of brownies out on the counter and the kids may not know that there's marijuana in it. So marijuana extracts are where they take the THC and they extract it and make it very, very strong. And they use butane, among other things, to in a lab, which is often in a house, and it's caused fires and explosions. And I will tell you that a couple summers ago in my neighborhood, house went up in smoke because of that. So what they do is they use these extracts, which are often oils. You might hear it called shatter or honey. What it does is it looks like earwax, and what they do is heat it up and then extract an oil from it and then use it for smoking marijuana. So what happens when a person uses marijuana? Well, they inhale and then the THC passes from the lungs into the bloodstream. The blood carries the chemical to the brain and the organs throughout the entire body. The body absorbs THC, and then within 30 minutes to an hour, and sometimes less, depending on the strength of it, they generally feel the effects. So what happens is marijuana activates the brain cell receptors to make people feel high. So however, feeling high nowadays with this type of strong THC may not be the pleasant experience that it was back in the day. So what happens is it can make people have mental health problems like paranoia, anxiety, and even psychosis, where they lose touch with reality. So it's pretty frightening. The drug may impair thinking, memory, learning functions, and affect how the brain builds connections between the areas necessary for these functions. And of course, if a person's brain is still developing, it's going to impact their development. And some studies show that people who are regular marijuana smokers as teens lose 8 irreversible IQ points between after the age of 13. And it's not reversible. So I don't know about you guys, but I know I need all the brain cells I can get. So there's a lot of short-term and long-term effects of marijuana. Short-term includes altered senses. So for example, you see colors, but they're exceptionally bright. You hear noises and they're louder. An altered sense of time. So you think 5 minutes passed, but maybe it's 2 hours. Changes in mood, impaired body movement, difficulty with thinking and problem solving, impaired memory, hallucinations, meaning hearing voices and seeing things and feeling things that are not really there. And that's usually only with high doses of THC. Also with high doses, delusional thinking and psychosis. So pretty scary. And long-term problems can include breathing problems, because what's happening is marijuana is going into the lungs. And so it's the same breathing problem as a person who might smoke any type of tobacco product. So they could have a daily cough, phlegm, lung illnesses, and a higher risk of lung infections, an increased heart rate. And that can continue for up to 3 hours after a person stops smoking. It increases the likelihood of a heart attack. Problems with child development during and after pregnancy. So babies can be born at a lower birth weight. There's a risk of behavioral problems, problems with attention, memory, problem solving, and preterm births are also an issue. So I don't know if you have ever heard of cannabinoid hyperemesis syndrome, also known as CHS. So what's happening is people are showing up at the emergency department with severe anxiety, paranoia, psychosis potentially, and gastrointestinal problems. they have stomach pain, nausea, and vomiting for no apparent reason. They do tests necessary and nothing is wrong with these patients. It isn't until they ask a patient, are you using high levels of marijuana? Or, because addicts sometimes lie, do a urine drug screen to determine how much THC is in a person's system. Then they figure out that it is not a gastrointestinal problem at all. What it is the effects of using high THC marijuana. So I will tell you, the first time I ever heard about this, when we had an adolescent program, a 15-year-old girl was having severe stomach issues. Her parents took her to Children's Hospital in Detroit, where she had every invasive, expensive test known to man, and they couldn't find anything wrong. And a staff member got her aside and said, hey, just wondering, are you using marijuana regularly? And the girl said, yes, a lot, and I can't stop. And the staff member said, well, there's your problem. And that's how she ended up in our adolescent program. So if you know of anyone who's having stomach issues and there's no apparent problem for it, reason for it, consider the possibility that they're using marijuana a lot, frequently. And if you want to be sure, you can ask someone, and if they deny it, then doing a drug test will absolutely answer the question. So what helps this problem? And don't laugh at this, I didn't make it up. You can look it up if you don't believe me, but hot showers. For some reason, patients who experience this say that they get relief with hot showers. Of course, the other way to arrest this problem is to stop using marijuana. So what happens is, as people are severely nauseated, vomiting, they become dehydrated and often require medical attention, which is what brings them to the emergency department of a hospital, but that may not always be the case. You might have students who don't go to the hospital, but they're complaining about this problem. So with that, I will leave you with the thought that marijuana today is not as safe as you might think, just because it's legal. And I would encourage you to educate your students about this and encourage them not to use it. So with that, we will open it up to any questions or comments.
You guys, if you have any questions, let me know and I'll unmute you and you can go ahead and ask. In the meantime, Lisa, I thought that they were saying that what makes it medicinal is that they deal with those stomach issues, especially for people who are going through chemotherapy and that kind of,
Yes.
So
Yeah.
it really doesn't address those issues at all?
So it does. So somebody who has, so you've heard of the munchies, right? When people
Right.
use marijuana, they get hungry. Think about a cancer patient who is nauseated and can't eat, okay? They can't function, they can't fight their disease if they're not eating, they need nutrition. So marijuana in small amounts, not massive amounts, can stimulate a person's appetite and make them want to eat. Okay, so that in that way, it is helpful. But when people are using it recreationally to get high, it's not helpful in their life. And then, of course, you've heard about kids who have epilepsy or seizures and using marijuana. Suddenly, if they're using it, it stops the seizures. I'm not against that. If it's going to help a child, that's different to me than using it to get high. Now, there are plenty of people who say using it to get high once in a while is fine. And that is true, it's legal. If they're over 21, there's no issue. The issue is when it starts having some negative repercussions on their health and their life.
So Lisa, is it a different strand or brand of marijuana that they utilize medicinally than they do for the recreational use of it?
So I know that there are many different strains. I can't tell you which ones do what, but if you were to go to a dispensary, they would be able to tell you exactly which medications or which strains of marijuana do what. And the other thing I want to share with you, I don't know if any of you are from the Royal Oak, Michigan area, but tonight, the Royal Oak Community Coalition is speaking at a meeting in the city because a very wealthy businessman is opening a dispensary right near a school. It happens to be a trade school, and he claims it's not a school. However, these teens are getting high school credit to be there. So there's going to be a big debate in the city of Royal Oak about whether they should be allowed to open a dispensary near a school, which is against the law. So if anybody lives in the Royal Oak area, you might want to look into attending that.
Wow, okay. You guys, do you have any questions? You all have now the ability to unmute and ask, or if you want to type in the chat, please feel free. Okay, well, if there aren't any questions, we will then wrap this up. Lisa, thank you so much. It was an excellent presentation.
Okay, so I will see you on Thursday, I believe.
Absolutely. Angela, you wanted to ask something?
No, it popped up and said to speak. So I clicked to speak. I don't know. I've never seen that message before.
Yeah, I unmute everyone so that they could just ask their question or make their comment.
Oh, okay.
Go ahead.
Oh, I don't have anything to say. I
Oh.
thought it was interesting.
Okay, well, thank you then, Angela.
Thank you.
Anybody else before we go? All righty then. Lisa, thank you again. Great presentation, and I will see you Thursday.
Okay, thank you. Bye-bye.
Thank you everyone for joining. Everybody have a great day.